Welcome back. So we were having a discussion regarding the child development and how to make sure that the child gets a more nourishing environment where the critical thinkings of that child flourish. But also, Shahzad, so we have been through this COVID period 3 years back where it was horrible because there was a lockdown across the world. Why? Because there was this pandemic and it was very contagious, and it has wreaked the havoc across the world. So now there's another pandemic, or I would say contagious disease, which is also spreading by the name of monkey pox. And what does the name suggest, and what does it has to do with the monkey? Because we've seen that COVID also, I don't know whether it's a scientifically proven fact or not, but we heard the news about how it was transmitted through the bat to humans, and then it spread really very fast in the world, and that is why it was named as pandemic. So we would like to ask about what exactly does the monkeypox means, what are the symptoms, and how alarmed should we be at this development, because by the onset of it, it has a lot of similarities with the COVID, right? True. So we are very glad that we have been joined by Dr. Mujeeb Saab, who happens to be infectious disease specialist. Assalamu alaikum, and thank you so much for coming to our show.
Thank you very much. Walaikum assalam.
So wonderful to have you over here, and it's great to kind of have somebody answer our questions, that too in relation to monkeypox, because there's been a lot of news about it, but certainly we have never seen somebody sitting on a television or somewhere to make people more aware of it. Right. So once again, it's our humble effort. Thank you so much that you joined us. So please tell us a little about what is monkeypox, and is it an infectious disease or is this not? Or did it exist earlier as well, or do you think that it's a resurgence or emergence of the same disease which people might have suffered from, God forbid, unfortunately, in the previous years as well?
Thank you very much for inviting me and organizing such a nice session regarding disease which is going to be hot topic nowadays across the globe. As all of us know that there is a interface of human beings with the animals and other environments. So there are a lot of zoonotic diseases which were initially in the animals, which have been taken by the human beings and now are spreading in between the human beings. Monkeypox is one of such condition which and monkeypox nowadays called as mpox. It is a viral disease, it is an infectious disease, a contagious disease which can be transmitted from one human being to other. And historically, the virus was discovered back in 1958 from a monkey in a laboratory where monkeys were being held for some sort of experiments. And this is the reason that the name of virus was monkeypox. But later on, the disease was identified in human beings back in 1970-71, and since then, off and on, what we call in our language is a sporadic disease that it can happen at any time in any part of the world, and especially in people who are coming in interface with the animal or a virus due to their high risk professions like veterinarians and like other ones.
But Dr. Saab, what are the symptoms of that disease? Because we've seen the pictures of blistered hands, and obviously that do not look very rosy to the eyes in the first place, right? So what are the symptoms, and how alarmed should we be at
this? And it actually reminds me of chicken pox as well. Is there any similarity?
There are a lot of similarities from this. It is the, you can say, a virus from the same family which initially caused smallpox, cowpox, and now chickenpox. So we have fever with rash. Anybody presenting to you with fever and rash, which was previously considered as a patient of chickenpox, in the current scenario, we will think that he might be suffering from monkeypox as well. The main simple features are features of any viral ailment, that is fever, that is headache, flu-like symptoms, in association with a rash. The difference between the rash of chickenpox and monkeypox is that it mostly affects the face of the patient, and one dreadful thing is that when it involves the face, it may involve the eye and may cause permanent blindness in around about 20% of patients
with mpox.
With mpox. So it is considered a dreadful disease.
Right. So is it a fatal disease in the first place?
Not so much fatal. The fatality has been mentioned in literature from 1 to 5%, depending upon the immunity of the patient. But it is a devastating sort of
Yes.
disfigurement of the face and other part. Second thing, it is contagious. There is a possibility that one man can infect the second one. So the chain of infection should be broken at any given time.
Exactly, and I would certainly want to come back to this point as well. But what I wanted to ask you over here was that just yesterday, World Health Organization actually announced that COVID is no more a global emergency. And do you think that Mpox, because there's been a lot of news about it, can it become a global emergency? God forbid. You think, because when we talk about how people are going to get it, for example, because my understanding was that with flu we say that it's R2 or R4. And with COVID, we used to tell people that it was R8, that 8 people can actually get it from you. So how is it with monkeypox now?
You are very well aware of or not for the audience. I can tell that it is the infectivity rate that one man can infect 8 people, say, in COVID. But in this particular case, it basically is it is not a droplet infection.
Okay.
It is basically infection which one can get by contact. If you keep a distance from a person who has infection, there are very less likely chances that exact R0 has not yet been established. Reason being that no more patients have been seen in the clinical scenario.
Yep.
But it is considered that it is a dreadful disease because we have seen that in the early centuries, we have lot of deaths from cowpox and smallpox.
True.
So we are afraid that if there is some sort of emergence, some sort of mutation in this virus, it may become dreadful. Presently, the last few epidemics have been noted in the globe, but they were considered very small. For example, although we are very well aware, we are alarmed by monkeypox, but we have only 3 patients which have been turned out to be positive in Pakistan.
Right.
But in our public health sector, we are very well prepared, and we are sensitizing the general public and healthcare professionals in order to prevent themselves. And the prevention is basically the same prevention as we have been following in case of COVID-19. The main thing.
So do we still have to wear masks? Do we have to sanitize?
Of course, we must do the same practices. Reason being, COVID is not yet out.
Yeah,
we have some positivity rate of COVID, and we should be aware that all the viral infections are there, and in order to contain them, we must follow the general hygiene principles.
So whenever we are to speak about COVID, and obviously not the mutated versions of COVID as well, I think because of herd immunity now, people, they only experience like, I think, slightly flu, something of that sort, and they alhamdulillah get better.
I do agree. In the initial phases, it was more causing pneumonia, and which was fatal pneumonia.
True.
For last 2 levels, it has been turned into relatively milder disease, just like flu-like disease. But again, any mutation can occur, as we have been seeing that 8-9 mutations have so far been recorded in last 2.5 years.
Yep.
So we should be aware, and we should be taking care of it.
So anybody who wakes up with, I'm very sorry, Rajesh, so anybody who wakes up with, flu and rashes, that's something, or temperature, they really need to kind of rush to the doctor at that very point, or do you think that they can do something at their homes too?
No, they should not do something at their home. They must see their
family
physician.
No,
not at all in this particular case, since it is a public health sort of disease. So you can infect the rest of your fellows and people.
But Dr. Saab, can it be curtailed in the initial stages so that we don't advance towards that disfigurement stage of our physical features which you talked about? If we get
once disease start, it is difficult to stop the clinical course. But you can prevent it. It is a preventable disease. So if you do the proper preventive measures, it may not.
All right, and sir, in addition to that, obviously, since we are speaking about it, there's just one simple thing which I wanted to kind of share with our audiences, and that is that, so for example, when we take birth, when we come into this world, obviously we get a lot of injections and vaccines too as well, to avoid or to make sure that, that we do not get such fatal illnesses. Do you think, is there any such vaccine available that we might even just kind of bypass monkeypox rather than getting it?
Yes, vaccine is available, and the same vaccine which was used for smallpox eradication is 85% successful in this case scenario, but it is not recommended for mass vaccination in general population. It is for the special people who are at more risk, clinical people working in laboratories. So they are
What is the
advised.
name of the vaccine, sir, if you would?
It is available with different names, not available in Pakistan presently, but it is available. Johnson is making one of them, and it can be available in different names at different times.
Right. So Dr. Saab, today is 8th of May and we talked about today is the World Thalassemia Day, right? So why it is important to observe this day in the first place, and how many people are vulnerable toward this particular condition? Is it a condition? Is it a disease? We want to be sensitive towards how we approach this topic. So as a doctor, how would you recommend?
Thalassemia is basically a genetic disease which can be transmitted in families, and it is a preventable disease. Most often seen in the scenarios where consensual marriages are being taken, and in our society it is usually a habit of having consensual marriages.
सर कोई और रिश्ता नहीं देता, लड़के कुछ करते नहीं है तो फिर चाचे से मामे से किसी से तो लड़की लेनी है उन्होंने, वो क्या करें फिर? टू बी वेरी ऑनेस्ट, आई थिंक
वो जरूर ले लें, लेकिन उससे पहले टेस्ट करवा लें, अपना भी टेस्ट करवा लें. और
and you know I think you've made a very valid point over here. The very moment you're going to open your mouth, you know, even if you are a girl's family and you have a daughter, you're going to tell the other person, yeah, why don't you go get yourself tested? How hai? Sade putar nu ki ho gaya? You know, things like that. We really need to get over that.
So this is the awareness you are creating among the public. So I think people have seen so miseries with patients with thalassemia that they now are themselves considering. I have seen lot of patient coming to me that I have a recessive gene of thalassemia. What should I do for my children? So they are getting aware, but this awareness is good, which you are creating.
But Dr. Saab, we've seen especially among the population which is very vulnerable to thalassemia and in the low income groups, right? So already poverty is a big factor in their lives that is preventing them from the access to the healthcare. But then thalassemia, if they have this condition, I mean, are there any incentives out there through which they can go for the better treatment out there? And do you think that those populations are more vulnerable to this particular genetic disorder?
There are certain families, there are certain groups, and families most often know that one of our relative was having such sort of disease. So if you take a deep breath and consider that this interconsensual marriage has caused this one, I think people are now aware with so much media and WhatsApp groups and all these that they take care themselves as well. But this awareness day like today's is the one of the chain factor that creates this awareness.
Exactly, and thank you so much, Dr. Saab, for being with us, and lovely to be in conversation, and thank you so much for letting us, you know, first of all, you know, share with us that, you know, that monkeypox obviously is treatable, alhamdulillah, it's preventable as well. There are a lot of vaccines which are available, a lot of research has been done on that too as well, but it is not recommended for people or general public to have on larger scale as well. For people who are at the helm of affairs, you know, looking after probably, you know, developing more vaccines, you know, to kind of curb the menace of monkeypox. Then coming down to thalassemia, I think this is something which I would want to say it in Urdu as well to our audiences out there. You've heard it in English, and that is that जब हम cousin marriages कराते हैं, जब हमारे फुप्पा का लड़का जो है वो हमारी चाची की लड़की के साथ हमारी शादी करने लगते हैं, क्योंकि फुप्पा का लड़का कुछ नहीं करता होता, लेकिन फुप्पा की एक इज़्ज़त होती है ख़ानदान में, तो वो अपने किसी रिश्तेदार से ढूंढते हैं अपने बेटे के लिए लड़की को कि जी इसके साथ हम शादी कराएंगे. तो इवेंचुअली काफ़ी सारे इसमें मसले मसाइल आते हैं, जिसमें से एक थैलेसीमिया भी है. चूँकि आज हम थैलेसीमिया का दिन मना रहे हैं, वो एक ऐसी बीमारी है जिसको हम अवॉइड कर सकते हैं 100%, जिसमें से बच्चे को गुजरने की बिल्कुल कोई ज़रूरत नहीं है. उसका सिर्फ एक इलाज है कि आपने अगर शादी करनी भी आप ज़रूर करें, हम आपको नहीं रोक रहे हैं, वो सिर्फ एक इलाज है, आप टेस्ट करा लें, लड़के का भी करा लें, लड़की का भी करा लें, ताकि किसी किस्म का कोई किसी जगह पे एतराज़ ना रह जाए. और अगर तब भी खुदा ना खास्ता ये इन लोगों को लगता है कि जी हाई जी हमारे बच्चे को क्या बीमारी है, तो अगर आप ऐसी बात करेंगी एज अ पेरेंट, अब माँ होते हुए बाप होते हुए आप जाहिलों वाली बात करेंगी, ये मैं आज टेलीविज़न के ऊपर आपको बैठ के कह रहा हूँ, क्योंकि बच्चों की जो आपकी फ्यूचर जनरेशन की सेफ्टी है उसको इंश्योर करना भी मेरा ख्याल है पेरेंट्स का ही काम होता है, सिर्फ अपने बच्चों को डिफेंड करना नहीं होता. आई थिंक दैट्स प्रीटी मच अबाउट इट.
Thank you so much, Dr. Saab, for coming here on our show and for creating awareness regarding the thalassemia and also the monkeypox. And with that, we would like to wrap up our segment and say goodbye.